When delivering an HIV-positive test result, it is essential for providers to be able to convey the information simply and clearly, support the patient's response to the news, provide information about the benefits of medical care, and offer referrals for any additional assistance that may be needed. This video was developed as a resource to assist providers in developing skills in delivering HIV-positive results. In this video demonstration, Jamal, a 24-year-old gay man, is returning to the clinic where he was given an HIV test as part of a routine health screen. He was contacted by the provider and asked to return to the clinic for his HIV test results. This video will demonstrate how to 1. Deliver the HIV test results in person if possible, 2. Help the patient to understand the results, and 3. Refer for medical follow-up and other appropriate services.
Hey, Doc.
Hi, Jamal. I'm glad that you were able to come in today.
Yeah, I gotta admit I was a little nervous when I first got your call.
Well, I'm glad that you were able to come in so that we can talk in person. I have your HIV test results. Are you ready to hear them?
Oh, wow, I don't know. What if I said no? I'm not ready.
Tell me, what did you feel would change if you were to learn your HIV results today?
I don't know. I guess that's why I'm nervous. So yes, I'm ready to hear my results. I think I would probably go crazy if I had to wait any longer.
The tests detect the presence of HIV in your body. This means you're living with HIV.
Wow. I don't know if I'm more shocked or relieved. I wonder if this is why I've been feeling a little off lately.
It's possible.
I don't know what I'm supposed to do now.
Can I share with you some next steps that others have found to be helpful?
Yeah, please.
A first step would be to get you connected to HIV care as soon as possible. That way we can do some more tests to find out how your HIV impacts your health and come up with a plan to treat it. How does that sound?
Sounds like a first good step.
It is. HIV is a manageable illness like high blood pressure or diabetes. We know with proper HIV treatment, people can live long, healthy lives. Treatment can also help you to avoid transmitting HIV to others. We refer to it as treatment as prevention.
Oh, is that similar to U equals U? I see a few guys' online profiles, and it said that they're positive but undetectable.
Yes, it is. We know when someone achieves and maintains an undetectable viral load, they're connected to care, taking their HIV medication daily as prescribed, and that medication helps to keep the amount of the virus in the body very low. We also know that maintaining an undetectable viral load means you have effectively no risk in transmitting the virus to an HIV-negative sexual partner. Does that make sense?
Yes, it does. And you can connect me to care?
Oh, absolutely. We can take care of you here through the clinic, or if you have another provider that you would like to go to, we can certainly help with the referral. Which of those two options work best for you?
I think I want to come here, if that's possible.
Okay, I'll connect you with one of our nurse case managers who will schedule a follow-up appointment. They'll also coordinate with your health insurance or other resources that may help to support your care.
Okay.
Jamal, another step that often comes up for others is how to tell their sexual or needle-sharing partners about their diagnosis. Now, I'm wondering for you, are there people who you might want to let know about your status?
There's a couple of guys I messed with last year. I definitely want to let them know, but I don't do drugs, so.
Oh, well, that's helpful to know. We have someone here who can help you with options to inform them and encourage them to get tested. It's free and can be completely confidential.
You know, Doc, I've heard a lot of guys say they would never date a guy who's positive. I guess I never realized I was putting myself at risk.
Jamal, it's unfortunate that there's still a stigma for people living with HIV. I work with many people living with HIV who come in for their routine medical visits with their boyfriends, their partners, their husbands, and they never thought they'd have sex again, let alone a loving partner. And yet they do.
That's good to know. I mean, I don't know everything, and this is definitely a lot to soak in and process right now. So
It is a lot to process, and Jamal, you're doing great. Tell me, who do you have in your life that you feel might help support you?
I'm fortunate. I have a couple of good friends who actually are living with HIV who I can talk to. They were the ones who actually convinced me to come get tested in the first place.
Well, that's great that you have friends who understand living with HIV. If you feel the need for other options, like a support group or individual counseling, the nurse care manager can help coordinate those resources for you. Is it okay if I give you this pamphlet? It has some of the basics about having HIV. It has some helpful information which might also help you understand how HIV works and the importance of treatment.
Thanks.
Jamal, the most important thing to remember is that treatment works. If you feel uneasy about anything your medical team is saying or suggesting, it's okay to ask questions. The more you learn, the more you can advocate for yourself and your health.
Thanks. I really appreciate that.
I know it's a lot of information, but how are you feeling about everything right now?
Well, I'm feeling a little less nervous, knowing that I can live a healthy life with HIV, as long as I'm connected to proper care. It's also nice to know that I can reduce the chances of spreading HIV to anybody else.
I know for a lot of people, the thought of having sex is the furthest thing from their mind. If and when you feel that you're ready, it is important that you use condoms to protect yourself and your partners. So I'm going to give you a few condoms when you leave here today.
Yeah, thanks. I appreciate that. My safety, my partner's safety is the most important thing to me.
Great. So let's get you signed up with the nurse case manager, and if it's okay with you, I'd like to check back with you in 2 weeks to see how you're progressing and if you need any additional support.
Yeah, that'd be great. Oh, thanks, Doc.
Now that you have viewed the video, we would like you to think about 1. Which techniques or strategies stood out for you and why? 2. What might you have done differently and why? Delivering HIV test results is a critical step for providers in helping to identify individuals who may be unaware of their HIV infection or at risk for acquiring HIV. It also allows medical care providers to rapidly link those identified as living with HIV into treatment as well as interventions that will prevent transmission and to provide HIV-negative individuals with appropriate risk prevention counseling and interventions. For more resources on delivering HIV test results, please visit